In this short video, we're going to look at the applications and some of the complications associated with a thoracic endovascular repair, also known as a TEVAR. We can see that such a device has been placed in this patient, and we're going to look at the axial images on a standard viewing window as you would normally encounter in your practice. The patient has had a previous dissection. To understand the principles of the TEVAR and its associated devices, we need to understand the orientation and the extent of the original dissection. If an aortic dissection is beyond the level of the left subclavian artery, it is termed as a type B in terms of the Stanford classification. But even in such cases, such as this one, we would need to secure a landing zone for the proximal end of the graft. This is a averaged image and this is a MIPT image, and we're going to re-window this image so you can look at the graft components better. We're going to orient it in such a plane that it's readily visible, such as in this situation here. And you can see that to achieve a satisfactory landing zone, we need to cross the opening of the left subclavian artery. If this artery is occluded as part of the deployment procedure, it can result in disastrous consequences. As a precautionary measure, this procedure is preceded by this intervention. At first, the patient will get a conduit or a bypass procedure to secure the blood supply to the left arm, and in this case you can see that there is a bypass vessel at this location here from the carotid to the subclavian, like that, and this allows the ostium of the left subclavian artery to be first occluded with an AMPATS plug, then the thoracic endovascular repair can be successfully deployed beyond this region. Another important point to consider is the supply to the vertebral arterial system, and the plug should always be proximal to the vertebral arterial origin, such as in this case. References and videos containing further important information on this topic is linked below.